What's going on, everyone? It's James from the McMillans, and today I'm doing a CP Awareness Day live stream. Today, March 25th, is National CP Awareness Day. I hope you guys are wearing your green in support. So I'm gonna be talking to you guys about cerebral palsy, which is the disability I have, um, and what causes it, stuff I've been through, answer you guys' questions. Um, I'm gonna look up some assumptions and then tell you guys some things about it. So yeah. So what is cerebral palsy? Cerebral palsy, um, in basic speaking, from what I can remember, is uh, caused by trauma to the brain that during birth or sometime after birth. Um, and it can affect people in many ways, mainly by gait, by strength, gait being the way you walk, strength, you might have some speech problems, some problems swallowing, core problems setting up, and you would sorry if I get like emotional. This stuff is like really important to me. Um, you would know if your child would have uh, CP if they are developing the milestones of if they're like not developing the milestones correctly, like if they're not walking at a certain point, or if they can't sit up on their own, or you might notice that their feet, common thing about a severe thing about CP, it causes um, your feet would turn in. At least that's what my case is. And okay, and then there's multiple types and what I call subtypes of CP. Um, Starting with from what I have is spastic quadriplegia uh, CP, and that means that all four of my limbs are affected. Um, my hands, my feet, my legs, my arms. It also affects, some of my GI stuff and other stuff like that. Then you go into hold on, let me look it up so I get the facts correct. And the resource that I usually go to is like Mayo Clinic because so hold on just a minute. It's coming. Okay. Symptoms. Risk factors I want to go is complications, prevention, diagnosis and treatment, brain scans, stuff I'll go into later, but what I want to go into is the type of CP. Alright, no. Alright. So you have spastic quadriplegia, spastic diplegia, spastic hemiplegia, or okay. Spastic quadriplegia, spastic hemiplegia, spastic diplegia. And here's a diagram of how it's described. Turn around. So I never heard of monoplasia, but monoplasia is just one limb. Hemiplegia is if like you split your body in half. Only one side is affected. Diplegia is like another side is affected, and then quadriplegia, all four limbs are affected. So, let me just zoom in here. Let me just zoom in so I can read. Part of my CP is I have low vision. So if you guys didn't know that, I am like probably blind. Monoplasia, hemiplegia, diplegia, quadriplegia. Okay. Next, I'm going to go backtrack into causes. Now that I'm on the, we're going to go page by page. So I am going to go back. Forgive me if my reading isn't so good. Part of my CP is a learning disability, so yeah. CP is a disorder of movement and muscular tone or posture that is caused by damage that occurs to the immature development of the brain, most often before birth. Signs and symptoms appear during infancy or preschool years. In general, cerebral palsy causes impaired movement associated with abdominal reflexes, floppiness, or rigidity. RIGIDITY. And if Mike was here, he would help me say that. Uh, of limbs, meaning that they're tight, and trunk. Abdominal posture, involuntary movements, unsteady walking, or some combination of these. People with CP may have problems swallowing, commonly have eye muscle imbalance in which the eyes do not focus on the same object, also known as stigmatism. Uh, People with CP also may suffer from reduced range of motion uh, in various joints of their bodies due to muscle stiffness. CP effect CP's effect on functional abilities varies greatly. Some affected people can walk while others can't. Some people show normal or near normal uh, intellectual capability, but others may have intellectual disabilities. Epilepsy, blindness, or deafness also may be present. Symptoms. Signs and symptoms can vary greatly. Movement and coordination problems associated with CP may include variations in muscle tone, such as being either too stiff or too floppy. Fun fact, Michael has, I have the too stiff part of CP. Michael has the too floppy. He has a lack of muscle tone. Stiff muscles and spasticity. Stiff muscles with normal reflexes, rigidity, lack of muscle coordination, ataxia. Ataxia is what I classify as a subtype because you have like cerebral palsy, spastic quadriplegia, and ataxia. That's how most people say that. And then moving on to the next one, tremors or involuntary movements. That has to go with spasticity, in my opinion. Slow uh, slow movements, athetosis. Michael, athetosis, in what I can observe from it, is your gait is like really off. Delays in reacting motor skills milestones such as pushing up on arms, setting up alone, or crawling. Favoring one side of the body, such as reaching with with only one hand or dragging one leg while crawling. I have that. I think I favor my right leg. and right arm and right hand. Um, Difficulty walking, such as walking on toes, have that. A crouched gait, um, a I don't know how to say that, like gait with knees crossed, have that. A wide gait, or and I don't know how to say that. Asymmetrical gait. Exclusive drooling problems with swallowing, don't have that. Difficulty with sucking or eating, don't really have that. Delays in speech development or difficulty speaking, kind of. Difficulty with uh, like fine motor skills, such as picking up a pencil or spoon, don't really have that. Seizures, don't have that anymore. Um, then you go into like secondary things that affect, such as difficulty with vision or hearing, intellectual disabilities, and seizures, abnormal, uh, like being uh, overly sensitive to like touch and stuff, um, oral disabilities. Um, I have I have a small mouth, which is really ironic because yeah, I'm not gonna go there. Um, but I also have, if you can see, that's disgusting. Give me a minute. Just give me a minute. 1 minute. I'm gonna go get something to drink, so I'll be right back. Because my throat's getting dry. And I'm back. Alright, so where were we? forgot where we were. So yeah, okay. Oh yeah, I'm still not done. I'll be right back. Got like something on my gum that's really bothering me, and I don't want to pick it in front of the camera. Okay, it might be now then. Okay. After oral diseases, or yeah, oral diseases, it's mental health. Now, mental health in uh, physical disabilities, I feel like it doesn't get enough spotlight, and I feel like mental health in a someone with a physical disability like and as complex as CP should get more spotlight because uh, people with CP get bullied a lot. They feel pressure because they get treated differently, even though like you may not notice it. Uh, we know that we're not as good as most people, but that's mainly focusing on the intellectual disabilities. So yeah. Moving on. Um, and then it says when to see a doctor, causes. Okay, I'm just gonna quickly go over like the causes. Uh, Mutations. Um, Infection. Fetal stroke. Infant infant infections. Traumatic head injury. Lack of oxygen. I'm guessing that another thing that is okay. This will probably be brought up in the risk factors, which is what's next. Um, but I was born pretty much premature. Uh, so yeah, with twin transfusion syndrome is when you have twins and like one twin is taking like the nutrients or the oxygen from the other. I was taking all the oxygen from Michael, so even in the womb I was kind of a dick. Um, uh, yeah, I'm not gonna go into like the infectious diseases, uh, but here it is. Okay, breech births, okay. Complicated in labor and delivery, low weight, low birth weight, multiple babies. Check that. Premature birth. Check that. Uh, compl- Complications. I'll just go through here. Okay. Com- oh, Contracture. Contracture is muscle tissue shortening due to severe muscle tightening spasticity. Contracture can inhibit bone growth, cause bones to bend, and result in joint. I have that. Malnourishment, swallowing, and feeding problems may make it difficult for someone with CP, particularly an infant, to get enough nutrients. This may cause uh, impaired growth in weaker bone and weaker bone. Some children may need a feeding tube for a to acquire nutrition. Mental health. People with CP may have mental health psychiatric conditions such as depression or social isolation, and the challenges of coping with disabilities can contribute to depression, as I brought up, before. Lung disease. People with CP may develop lung disease and breathing disorders. Neurological conditions. People with CP may be more likely to develop movement disorders or worsen neurological symptoms over time. Arthritis. I have arthritis. Pressure on joints or abnormal alignment of joints from muscle spasticity may lead to early onset painful degenerative bone disease, arthritis. And then there's another thing, but I don't know how to read it. And there's like eye muscle imbalance, which is like nystagmus. And then prevention. Do I really need to go over like prevention? Make sure you're vaccinated while you're pregnant, take care of yourself, seek early continuous prenatal care, practice good child safety, yeah. And then going on to diagnosis and treatment. If your family doctor or pediatrician suspects that your child has CP, he or she will evaluate your child's signs and symptoms, review your child's medical history, and conduct a physical evaluation. Your doctor may refer you to specialists a specialist trained in treating child with brain and nervous system conditions, a pediatric neurologist. Your doctor will also order a series of tests, making the diagnosis and rule out other possible causes. Brain scans, MRI, infant ultrasound, EEG, lab tests, additional tests, vision impairment test, hearing impairment test, speech delay impairment test, intellectual disabilities, other developmental delays, treatments. Pediatrician and see a pediatrician, pediatric neurologist, physical therapist, and occupational therapist. OT and PT. If you have CP and you are tired of PT and OT, tough bloody luck. Because if you have severe CP or special quadriplegic CP, like I do, it will stick to you like glue. Enough said. Physical therapist CP works on like mobility, like walking and crawling skills, while a occupational therapist might work on the fine motor skills such as like eating and day-to-day tasks like cutting food and stuff like that. And yeah, they also talk about adaptive products such as like grips and stuff like that. Speech language pathologist. I haven't had to work with a speech therapist, but a speech therapist would also work on swallowing. I don't know. I don't get that. A developmental therapist. I don't know if I had to ever. Probably when I was little. And a mental health specialist. Um, okay. When I was growing up, we didn't have very well mental health professionals in where I was growing up, so I didn't really get that much well treatment. I mean, they tried, but yeah. Uh, recreation, recreation therapist, participation in art and culture products, sports, and other events that help children expand their physical and cognitive skills and abilities. Parents of children often note improve. I don't. I never had that, like at all. Social worker, yeah. Special education teacher. I've had multiple special education teachers, and none of them have been quite as well as my transition specialist, also known as my high school uh, sped teacher. She was amazing. Um, you know, I kind of feel bad for sped teachers because they kind of get like they're kind of low on the totem pole but they get all their their payload is a whole. Um, they have to deal with more. Not only do they have to deal with people with physical disabilities, but intellectual and sometimes mental disabilities as well. Um, so yeah, I have a lot of respect for sped teachers, and I'm saying to this: if you're a sped teacher or you're going to be a sped teacher, God bless you. Okay, medications. Uh, what? There's isolated spasticity and generalized spasticity. Uh, so I'm just gonna read this. When spasticity is isolated to one muscle group, your doctor may recommend Botox injections directly into the muscle or nerve or both. Botox injections may help improve drooling. Your child will need injections about every 3 months. Side effects may include pain, mild flu-like symptoms, bruising, severe weakness. Other more serious side effects include difficulty breathing and swallowing. I remember the bruising when I had Botox. generalized spasticity. If the whole body is affected, oral muscle relaxants may relax stiff connected muscles. These drugs include Valium, Ditrum, and Baclofen. I have a Baclofen pump. What else I'll get into later. Daclazam carries the detrimental risk, so it's not recommended for long-term or dependency risk. Yeah, I knew that. So it's not recommended for long-term use. Its side effects include drowsiness, weakness, and drooling. Baclofen includes sleepiness, weakness, nausea, and let me just go down to Baclofen, because I don't know what that other one is. Okay, Baclofen side effects include sleepiness, confusion, nausea. Note that Baclofen may also be pumped directly into the spine with a tube. The pump is surgically implanted under the skin of the abdomen. They don't really do under the skin anymore. They try to do it underneath the muscle. I'm going to show you guys my pump. First of all, I'm going to make sure I have it. So, that right there, yeah, right there, you can see it there, is my Baclofen pump, and it delivers Baclofen directly to my spine, which delivers it to my muscles, loosening it up. If I didn't have the Baclofen pump, I'd be really stiff. So yeah. I'm gonna go on to therapies right now. Hey, what's up?
Oh my gosh. Where's your trimmer?
My razor is in.
Oh, you're gonna shave him?
I've got to do something you won't want to see, man.
Oh,
You stay in bed.
I'm not in bed. I'm at your desk.
Oh boy. You stay there. I have to do something you won't want to see.
Shave. Anyway. Hey Michael, do you want that electric shaving oil that I have?
Yeah, what's up when you clean that thing?
I don't clean a thing.
Alright. You ready?
Ready.
Yeah, close your mouth. Close your lips.
This is gonna be interesting. Physical therapy. Muscle training and exercises may help your child's strength, flexibility, and balance.
Are you going to be clean shaved or what do you want?
More development and mobility. You'll also learn how to safely care for your child's everyday needs at home, such as bathing, bathing and feeding your child. It's basically, yeah.
Is your mouth shut? No? That's how you get hair in your mouth.
For okay. Skipping down a paragraph. For first 1 or 2 years after birth, both physical and occupational therapists provide support with issues such as head and trunk control, rolling and grasping. Later, both types of therapists are involved in wheelchair assessments. Braces or splints may be recommended for your child. Some of these supports help with functional, such as improved walking, others, such as stiff muscles, to help prevent stupid words. Occupational therapist. Using alternative strategies and adaptive equipment, occupational therapists work to promote your child's independent day-to-day activities and routines in the home, school, and community. Adaptive equipment may include walkers, canes, seating systems, or electric wheelchairs. Speech and language therapists.
My brother.
I shaved recently.
You should see my brother. You should have seen my brother's before you shaved.
Was it long?
Not as long as yours.
Not only mine, but almost.
Recreational therapists. Some children may benefit from recreational therapy, such as therapeutic horseback riding. This type of therapy can also improve your child's motor skills, speech, and emotional well-being. Now begins with the really interesting stuff. Surgical and other procedures.
What you're doing now, something you do at the center. What you're doing now, sounds like something you do at the center.
Gotta have you looking good for your counseling part of it.
Oh, I've gone to have been looking worse, much worse.
Children with severe.
Dr. Hyde just doesn't my mind.
You go by yourself if it takes you.
Dr. Hyde just does.
Does he come here? He or she?
He does. Dr. Mark Hyde does.
Does he come here?
Yeah,
Oh.
I mean, I think it was only one time he actually had to come into the building.
Oh, really? I just have one little patch left of.
I think I might make a part 2 to this. I'm kind of having a hard time focusing. So yeah, make sure you like, share, comment, subscribe, turn on notifications so you don't miss another video, and I'll see you.